Hi, my name is Dr. Jacqueline Smith. I'm one of the OBGYNs. I work out of New Jersey, New York, and California. It was great. A lot of it is about bringing awareness to the community about the importance of women's health, the importance of doing self-breast exams, importance of pap smear screenings. It's something that we routinely and commonly do in the United States, but here it's more of a luxury. So just trying to educate the patients here and offering whatever services we can helps not only that patient but also their community, because a lot of times we're giving them information that they can take back and use in their community as well. We need more. We need more people that are willing to dedicate and donate, volunteer their time, especially the financial aspect. So we need donors, people who are going to help sponsor. Like today we were doing pap smears, but those pap smears still have to be read by a pathologist. So if we can't have a pathologist on staff, we need the money so that we can get these specimens to a pathologist, etc. So the outreach is really, really, really important, but we need more of the outreach and more people willing to come out and help. I mean, I love Jaja Foundation. I think its mission is very pure. The people of Jamaica are at its heart and center. Every year we're coming back, we're doing different projects, different things to outreach, and every little bit that we do will make a big difference in the long run.
Well, thank you for your service and thank you for being here.
No problem.